What is the Braden scale used for? Your options are assessing fall risk, measuring pain levels, predicting pressure ulcer risk, or evaluating nutritional status. The correct answer is C, that is predicting pressure ulcer risk. The Braden scale is designed to assess a patient's risk of developing pressure ulcers based on 6 factors such as sensory perception and moisture. Question number 2. Where does fertilization of the egg typically occur? Your options are uterus, ovary, fallopian tube, or cervix. The correct answer is C, that is fallopian tube. Fertilization usually takes place in ampulla, the widest part of the fallopian tube, where the sperm meets the egg. Question number 3. Which of the following is not a function of the skeletal system? Your options are support, protection, hormone production, or movement. The correct answer is C, that is hormone production. While bones do play a role in hormone regulation by releasing osteocalcin, they are not primarily responsible for hormone production. Question number 4. Nerves. The correct answer is A, that is brain and spinal cord. The central nervous system includes the brain and spinal cord that are responsible for processing and integrating information. Question number 4. Which neurotransmitter is associated with the mood regulation and pleasure? Your options are serotonin, dopamine, acetylcholine, or GABA. The correct answer is B, that is dopamine. Dopamine plays a crucial role in mood regulation and the brain's reward system, influencing pleasure and motivation. Question number 5. Which blood vessels carry blood away from the heart? Your options are veins, capillaries, arteries, or venules. The correct answer is C, that is arteries. Arteries carry oxygen-rich blood away from the heart to the tissues of the body, while veins carry oxygen-depleted blood back to the heart. Question number 6. Which structure connects the uterus to the vagina? Your options are ovary, fallopian tube, cervix, or labia. The correct answer is C, that is cervix. The cervix is the narrow lower part of the uterus that opens into the vagina, allowing passage of menstrual flow, sperm, and the baby during childbirth. Question number 7. What is the smallest bone in the human body? Your options are stapes, tibia, femur, or radius. The correct answer is A, that is stapes. The stapes, also known as stirrup, is located in the middle ear and it is involved in this transmission of sound vibrations. Question number 8. What is the term for a benign tumor of the pancreas that produces insulin? Your options are insulinoma, pancreatic cyst, adenocarcinoma, or islet cell carcinoma. The correct answer is A, that is insulinoma. And insulinoma is a benign tumor of the pancreas that produces excessive amount of insulin. leading to low blood sugar levels. Question number 9. Which of the following lifestyle modifications can help lower blood pressure? The options are smoking, sedentary lifestyle, high sodium diet, or regular exercise. The correct answer is D, that is regular exercise. Regular physical activity can help lower blood pressure by improving heart health, reducing stress, and promoting weight loss. Question number 10. Which of the following is a symptom of a shock? Your options are rapid heartbeat, low blood pressure, elevated body temperature, or increased urine output. The correct answer is B, that is low blood pressure. The shock is characterized by inadequate blood flow to vital organs, resulting in low blood pressure, among the other symptoms such as rapid heartbeat and cool and clammy skin. Question number 10. What is the name of the double-layered membrane surrounding the heart? Your options are endocardium, myocardium, pericardium, or epicardium. The correct answer is C, that is pericardium. The pericardium is a double-layered sac that encloses and protects the heart, providing a lubricated environment for it to move smoothly within the chest cavity. Question number 11. What virus is responsible for causing the common cold? Your options are influenza virus, rhinovirus, coronavirus, or adenovirus. The correct answer is B, that is rhinovirus. The common cold is often caused by rhinovirus, which are a predominant group of viruses. Which are a predominant group of viruses. Question number 12. What is the term for the first menstrual period in females? Your options are menopause, ovulation, menarche, or estrus. The correct answer is C, that is menarche. The menarche is the onset of the first menstrual cycle, marking the beginning of reproductive capability in females. Question number 13. Which substance is primarily responsible for the yellow color of urine? Your options are urea, uric acid, bilirubin, or creatinine. The correct answer is C, that is bilirubin. Bilirubin, a breakdown product of heme, contributes to the yellow color of urine, especially when levels are elevated as in jaundice. Question number 14. Which factor is essential for platelet adhesion to the damaged blood vessel wall? Your options are thrombin, collagen, fibrinogen, or plasmin. The correct answer is B, that is collagen. Platelets adhere to the exposed collagen fibers of the damaged blood vessel during the adhesion phase. Question number 15. Which structure is responsible for producing insulin? The options are liver, pancreas, gallbladder, or spleen. And the correct answer is B, that is pancreas. The pancreas produces insulin, a hormone that regulates blood sugar levels by facilitating the uptake of glucose into cells. Question number 16. Which part of the brain is responsible for processing sensory information? The options are cerebrum, cerebellum, brainstem, or thalamus. The correct answer is D, that is thalamus. The thalamus relays sensory signals to the cerebral cortex and is involved in processing and relaying sensory information to the other parts of the brain. Question number 17. What condition is characterized by the narrowing of the coronary arteries? The options are aneurysm, thrombosis, atherosclerosis, or arrhythmia. The correct answer is C, that is atherosclerosis. Atherosclerosis is a condition where plaque builds up inside the coronary arteries, causing them to narrow and reducing blood flow to the heart muscle. Question number 18. Which autoimmune disease targets the myelin? Targets the myelin sheath of nerve fibers in the central nervous system. Your options are lupus, multiple sclerosis, type 1 diabetes, or rheumatoid arthritis. The correct answer is B, that is multiple sclerosis. Multiple sclerosis is an autoimmune disorder where the immune system attacks the myelin, leading to nerve damage. Question number 19. Which test is used to evaluate bone marrow function? Blood culture, bone scan, complete blood count CBC, or bone marrow biopsy? The correct answer is D, that is bone marrow biopsy. Bone marrow biopsy is a direct method to assess marrow structure, cell production, and detect diseases like leukemia or myeloma. Question number 20. The interphalangeal joint of the toes are which type of joints? Your options are hinge, ball and socket, pivot, or saddle. The correct answer is A, that is hinge. The interphalangeal joints of the toes are hinge joints, allowing for flexion and extension of the toes. Question number 21. What is the main type of cell found in the liver? Your options are neuron, hepatocyte, erythrocyte, or leukocyte. The correct answer is B, that is hepatocyte. Hepatocytes are the primary functional cells of the liver. They carry out most of the liver's tasks, including metabolism, detoxification, and protein synthesis. These cells make up about 80% of the liver's mass. Question number 22. Which patient would most likely to have a high Braden scale score? The options are a bedridden elderly patient, a patient with good mobility and regular diet, a malnourished patient with moisture exposure, or a patient with impaired sensation. The correct answer is A, that is the patient. B, that is a patient with good mobility and regular diet. Patients with good mobility, adequate nutrition, and no sensory impairment tend to have higher scores, reflecting a lower risk of pressure ulcers. Question number 23. Which joint type is found in the knuckles? Your options are hinge, ball and socket, condyloid, or saddle. The correct answer is C, that is condyloid. The knuckles or metacarpophalangeal joints are condyloid joints, allowing for movements in two planes, flexion extension and abduction and adduction. Question number 24. What is the term for stoppage of bleeding, often through the formation of blood clot? Your options are hemolysis, erythropoiesis, hemostasis, or thrombopoiesis. The correct answer is hemostasis. Hemostasis is the process that prevents and stops bleeding, involving vasoconstriction, platelet plug formation, and coagulation. Question number 25th. Which type of joint is the elbow joint? Your options are hinge, ball and socket, pivot, or saddle. The correct answer is A, that is hinge. The elbow joint is a hinge joint, allowing for flexion and extension of the forearm. Question number 26. Which finding is most concerning in a shock patient? Your options are anxiety, oliguria, heart rate becomes 102 beats per minute, or BP will be 110/72. The right answer is B, that is oliguria. Low urine output reflects poor renal perfusion and worsening in shock. Question number 27. Which type of blood vessel contains the lowest blood pressure? Your options are arteries, capillaries, veins, or arterioles. The correct answer is C, that is veins. Blood pressure is lowest in veins because they carry blood back to the heart at a low pressure after it has passed through capillaries. Question number 28. What is the function of the corpus luteum? Your options are produce estrogen only, produce progesterone and estrogen, release the egg, or stimulate ovulation. The correct answer is B, that is to produce progesterone and estrogen. The corpus luteum secretes progesterone and some estrogen to maintain the uterine lining during the early stages of pregnancy. Question number 29. What is the primary function of the fallopian tubes? Your options are to produce hormones, to transport eggs from ovary to uterus, to nourish the embryo, or to prevent fertilization. The correct answer is B, that is to transport eggs from ovary to uterus. The fallopian tubes carry the ovulated egg from the ovary toward the uterus and are the site of fertilization. Question number 30. The nurse suspects hypovolemic shock in a trauma patient. So what is the priority? Your options are start oxygen therapy, apply compression stocklings, insert NG tube, or provide food. The correct answer is A, that is start oxygen therapy. Providing oxygen ensures tissue receive necessary oxygen during early management. Question number 31. What is the first step to take if a victim is unresponsive and not breathing? The options are check for pulse, call for emergency assistance, administer rescue breaths, or perform chest compressions. The correct answer is B, that is call for emergency assistance. The first step if a victim is unresponsive and not breathing is to call for emergency assistance before initiating any CPR procedures. Question number 32. Which blood vessels are the smallest in diameter? Your options are arteries, arterioles, capillaries, or veins. The correct answer is C, that is capillaries. Capillaries are the smallest blood vessels with diameter so small that red blood cells must pass through them in single file. Question number 33. What type of blood vessel receives blood directly from the heart? Your options are capillaries, veins, arteries, or venules. The correct answer is C, that is arteries. Arteries receive blood directly from the heart and transport it to the tissues of the body under high pressure. Question number 34. What is the clinical term for an unusually strong pulse? Your options are bounding pulse, 3D pulse, bradycardia, or tachycardia. The correct answer is A, that is bounding pulse. A bounding pulse is unusually strong and is often associated with high blood pressure or anxiety. Question number 35. Which factor could temporarily lower pulse rate? Your options are anxiety, physical activity, hypothermia, or fever. The correct answer is C, that is hypothermia. Hypothermia, or a drop in a body temperature, slows down the body's metabolic processes and reducing the pulse rate. Question number 36. Which blood vessels carries deoxygenated blood from the heart to the lungs? The options are pulmonary vein, pulmonary artery, aorta, or superior vena cava. The correct answer is B, that is pulmonary artery. The pulmonary artery carries deoxygenated blood from the right ventricle to the lungs, where gas exchange occurs. Question number 37. What type of blood vessel is known for having the most elastic tissue? Your options are veins, capillaries, arteries, or venules. The correct answer is C, that is arteries. Arteries, especially the large one like the aorta, have the most elastic tissue to accommodate the pressure changes from the heart's pumping action. Question number 38. What is the recommended hand placement for chest compression in pediatric CPR? The options are lower half of the sternum, center of the chest, just below the armpit, or over the abdomen. The correct answer is B, that is center of the chest. For pediatric CPR, chest compressions should be performed by placing the heel of one hand on the center of the chest, just below the nipple line. Question number 39. What is the correct technique for delivering rescue breaths in pediatric CPR? Your options are seal the mouth and nose with the rescuer's mouth, deliver gentle puffs of air into the mouth and nose, perform mouth-to-mouth ventilation only, or use a bag wall mask device for ventilation. The correct answer is B, that is deliver gentle puffs of air into the mouth and nose. In pediatric CPR, rescue breaths should be delivered by delivering gentle puffs of air into the mouth and nose to avoid excessive airway pressure. Question number 40. What is the main nursing goal in early shock? Your options are monitor intake, elevate extremities, maintain airway and oxygenation, or insert catheter? The correct answer is C, that is maintain airway and oxygenation. Ensuring oxygen delivery is vital to prevent cellular hypoxia. Question number 41. What causes cool, pale skin in shock? Your options are vasodilation, increased metabolism, peripheral vasoconstriction, or histamine release. The correct answer is C, that is peripheral vasoconstriction. The body redirects blood to vital organs, reducing skin perfusion. Question number 42. Which organ is responsible for detoxifying the body? Your options are liver, kidneys, lungs, or skin. The correct answer is A, that is liver. The liver plays a key role in detoxification, metabolizing toxins and waste products, filtering blood and producing bile to aid in the digestion, supporting overall health and wellness. Question number 43. What device monitors central venous pressure in shock? Your options are ECG, arterial line, CVP catheter, or pulse oximeter. The correct answer is C, that is CVP catheter. CVP measures preload and fluid status, guiding resuscitation. Question number 44. Which blood vessels have the thickest walls? Your options are capillaries, veins, arteries, or venules. The correct answer is C, that is arteries. Arteries have the thickest walls due to their need to withstand the high pressure generated by the heart as it pumps blood to the body. Question number 45. What is the average lifespan of an aortic graft after replacement surgery? Your options are 12 years, 5 to 10 years, 10 to 20 years, or over 20 years. The correct answer is D, that is over 20 years. Modern aortic graft can last over 20 years, allowing patient to live with a significantly reduced risk of aortic complications. Question number 46. What is the main purpose of the aorta's elastic fibers? Your options are to prevent tears, to allow expansion and recoil, to transport nutrients, or to regulate blood flow. The correct answer is B, that is to allow expansion and recoil. The elastic fibers in the aorta enable it to expand with each heartbeat and recoil to maintain blood pressure and flow. Question number 47. Which of the following blood type has no A, B, or Rh antigens? Your options are O positive, A negative, B negative, or O negative. The correct answer is D, that is O negative. O negative is the universal donor because it lacks A, B, and Rh antigens, which prevents immune reactions when transfused into recipients of any blood type. Question number 48. A person with blood type A can donate to which of the following blood types? Your options are A negative and O negative, A negative and AB negative, O negative and AB positive, or A positive and B negative. The correct answer is B, that is A negative and AB negative. A negative blood can be donated to individuals with A negative and AB negative blood types, as they share the A antigen and lack the Rh factor. Question number 49. Which layer of blood vessel is primarily composed of smooth muscle? The options are tunica media, tunica externa, tunica intima, or endothelium. The correct answer is A, that is tunica media. The tunica media is the middle layer of blood vessels, composed mainly of smooth muscles, allowing vessels to constrict and dilate to regulate blood flow. Question number 50. Which of the following substances is not normally filtered by the kidneys? Friends, it is a time to comment your score out of 50 questions. And friends, thanks for joining us on this exciting journey. If you enjoyed the quiz and learned something new, then give us a thumbs up and let us know in the comment section. And don't forget to subscribe and hit that notification bell so you never miss out on our upcoming exploration of fascinating topics in the medical field. Until the next time, stay curious, stay healthy. See you. Take care.